when the alarm went off, would it say, okay, in this room?
No.
Like how
You
you
had
just
to
have to look
find
for the
it.
crowd?
You had to
people?
find it. Yeah.
Oh, no.
And so
Terrible.
sometimes you couldn't find it. Right. And so you knew somebody
That's horrible
hit
for the person that hit
correct.
the button.
And you know what's really fun too is sometimes the patients would be like, it's over here.
Get them.
They'd be like, ah.
Hey guys, welcome to Nurse Talk, the podcast where we talk all things nursing. I'm your host, Mia, and today we have Claire.
Hi, everyone. So excited to be here.
Thank you.
Yeah.
Yeah.
It's going to be
Thank you
so
for coming.
good. Yeah. Thank you for having me. I'm so excited.
Awesome.
Yeah.
Okay, so I always start, same thing, why nursing?
So I originally didn't think I was going to go into nursing whenever I went into college. I always thought I wanted to go into medicine. I took anatomy in high school and I was really interested in anatomy. So I always thought I was going to go into medicine, but I didn't know what. And then as I got deeper into making decisions about my career, I just started really thinking, do I want to go to medical school? Do I want to go to PA school? Do I know all of that kind of stuff? And I just ultimately decided that to go down the nursing route. And I think a big thing for me was that no one in my immediate family was a nurse. Like my dad's a doctor, my mom has done the healthcare thing. And so I'm like, I want to do something that's me, something that's...
I love that.
Yeah. So, I didn't follow necessarily right behind a family member. I just decided to go for it. This is where it brought me.
That's awesome.
Yeah.
Yeah. I had the opposite. My grandmother was a nurse and then a nurse practitioner, and then my mom was a nurse, and then I fought it. I was like,
Hard.
I don't want to do what everyone else does, kind of, in that
Yes.
same sense. And then eventually I ended up
Here
here
you are.
anyway, but
Yeah.
it worked out.
Yeah.
Okay, so you started in psych.
Yes.
How did you get there?
So I took psych classes as electives. I started out with Psych 101 as an elective, and I really liked the psych courses. Learning about the mind and the psych issues and all that kind of stuff was so fascinating to me. I thought it was so cool, and it made sense. Everything was kind of, like, I don't know if I had really great professors or what, but everything made a lot of sense. And so I was like, I want to go into psych after college. I thought maybe I was going to get my master's in psych, and I ultimately went there. And it was 2019, so right before the pandemic. I had friends from college that we worked on the same floor together, and it was easy, kind of a transition. I had people I knew. I was there for almost 3 years.
Wow.
Yeah.
And you said that you were a nurse for pediatrics and adults?
Yeah,
psych?
so the psych unit was pediatric, adolescents, and adults all together. They were separate wings, so like they couldn't intermingle.
Okay, I was like, that's...
Yeah,
that doesn't sound right.
They couldn't intermingle, but you would be assigned to a side for the day. Yeah, and you could go anywhere.
That seems kind of difficult.
Yeah, it was very difficult, especially because I kind of realized I really liked the kids then.
Oh,
I was like, I really like hanging out with the kids, and the adults tended to be the more aggressive ones. And
absolutely.
So I was like, I'll hang out with the kids. We'll color all day. And, that was where I found myself leaning towards more.
What are some common misconceptions that people have about psych nursing?
Yeah, I mean, not all psych nursing is the violent, crazy behavior that you see on the news or on social media or anything like that. Now, can it be? For sure. Like, you have to kind of be realistic, because I think I wasn't so much. I thought that I was going to be immune and I was just never going to get beat up. So I think some misconceptions is that it's all bad all the time. That's not true. And I had a lot of great days, a lot of fun days there. That by far outweighs the bad. And we need psych nurses. The psych community is so undersupported that I don't want people to be scared of psych nursing just because of that's all the horror stories as you hear is how terrible it is. Yeah. So if someone is thinking about psych nursing, definitely go give it a shot.
What would you say your average day was like as a psych nurse?
You come in, you get report just like you would from everyone else. But the difference is that you don't get it in front of the patients.
Oh, yeah, no. Please don't.
You go, we're like in a conference room, and you get report on all of the patients. You hear what happened on the entire unit, not just your wing. So you kind of knew the story. You knew if you were walking onto a unit, you knew who was aggressive. You knew kind of what to expect. So you would come in, you would get like your assignment for the day. You get your report and you just get it rolling from there. Every day truly like had a similar schedule with what time breakfast was and that kind of stuff. For kids, they went to school, they had a teacher come. But every day was kind of different in the terms of actual like psych determining factors. Yeah.
Did you like the fact that you got report on the whole unit? Or do you feel like that was time consuming?
They kept it short and sweet. Like it was just like a little synopsis. Like you didn't talk about in depth about the patient history or anything like that. Because there might be like 30 patients.
Yeah.
And so it was a synopsis on how their night went or day went. And then you just kept moving. And it was, I mean, I liked it because then you kind of know anyone. So whenever you did go to that unit, you I remember last week, I remember this patient. Or someone that came that would, maybe someone got discharged and readmitted. Oh, I remember that person. I never took care of them, but I remember that person. So I liked that part of it. But yeah, but then again, the patients you were taking care of, you never quite had a detailed story. You had not that they truly had a long like medical history, but it could be relevant.
Yeah, of course.
Yeah.
What skills do you think are necessary to thrive in psych?
Patience. You have to have patience and a certain level of boundaries, because there are some patients, if they see that you're the person that'll hand out extra pudding, they will capitalize on that. Like just dumb things like that.
Oh, yeah.
Like people will take advantage of you, especially when they see someone that's 21 walking in on the unit that's, you know,
that looks sweet like you. You were a target.
Super innocent. Just like has no idea. And especially, I mean, I was innocent entering into my first career, my first job outside of college. I was naive. I thought everything was perfect and everyone was there to help you. And it's just not the case.
No. Yeah. I would be absolutely terrified to do psych.
Yeah.
I'm one of those people that's like, you know, because you do hear the horror stories.
Yes. And they happen, but it's not all bad all the time. You do see some patients make some great turnarounds.
Especially the children.
Oh, the kids were the best.
Yeah.
Yeah.
That must have been really sad, though.
Yeah, it was sad when you got really young kids.
How young would you say your youngest patient was?
The youngest I ever saw there was 3. Yeah.
3 years old?
3. And that, for me, was tough because I didn't think he needed to be there. But I wasn't, you know, a doctor admitted him. So and the reason that he was there was really silly, too. Like, he was there for having tantrums. I said, so he's acting like a 3-year-old.
Oh, my God. Can you imagine being the parent? They probably just wanted a break. Honestly, that's sad.
And that's the thing, too, is the amount of visitors that you would get there would be shocking, how few and far between they would be. Yeah. And I understand people work and people have lives, people have other kids, but like that was shocking to me. Like how few parents, even grandparents, whoever wanted to come was allowed to come. Yeah. Aww. Yeah. At least he didn't stay that long because we all kind of thought the same thing. We're like,
okay, you got 2 days, guys.
Yeah, they're like, okay, he doesn't need medication. Like, he's
3 years old.
Yeah.
Yeah. Do you have any stories that you'd like to share of Psy?
A lot of traumatic things, happened to me. More so, I would say, like, I knew my spot. I knew I was 5'3", and I knew there was men bigger than me. I was not the first person going into the room when someone had a shard of wood trying to stab you.
Oh, yeah, no.
I was working on the children's wing of the psych unit I was on, but it was converted into a general adult unit for the moment for overflow. And so it was late at night. I don't remember what time it was, but I remember it was dark. And it was like me and maybe one other person, and we were getting an admission from the police. They were bringing us an admission. And this person came in and was not happy to be there. They had just been arrested and then brought to the psych hospital and admitted against their will.
Okay.
So they were not happy. And the first people they saw was me and like my coworker that I was with. So they ripped apart the TV stand that we had and had shards of wood. And they were like, if you come over here, I'm going to effing kill you. And I was like, I heard that. I'll be over. I'm not going to test your theory. I trust you. Yeah. And they're just mad at anyone, right? Mm-hmm. The police come, they dump them off, and they leave. So they had this shard of wood in their hands on the unit. So it ended up being a whole weapons code that we had to call. And it was crazy. The security came with their like big blocking pads. and stuff just because they didn't want to get stabbed
yeah,
either.
of
And it
course.
was a big piece of wood with nails and stuff sticking out of it. Yeah.
So
Yeah.
I was going to ask you what type of security things that they have in place
Yeah.
for that.
The psych unit, we had these buttons that we carried on us at all times. And if
What was
you...
like a necklace or?
It was, so we had to wear lanyards because of the ligature risk of a retractable ID. So you wore
yes.
and you would have like, you'd either have it in your pocket or on your lanyard or somewhere where if you needed to get to it, you could. So it was this button and you had to push in, but you had to squeeze it so you wouldn't accidentally set it off if you sat on it or something. So you would squeeze it and this alarm would go off in the entire floor. And then security would get the alarm and they'd come running to where they were pinged to wherever you were. And they would come to wherever you were. So that was like the level of security. And then you could also call them if things were getting a little out of hand.
Like, hey, keep us on your radar.
Yeah, can you just want to come up here and join us for a moment? Like just before it turns into an emergency, before someone's getting hurt. But yeah, so that's what we had for security. Now COVID, when I was working on the COVID unit in the psych hospital, everything changed. Everything changed because you still had your button, except you were fully gowned up and security had to get fully gowned up to come get you. So it was a massive safety hazard because if you needed help, they were putting their
it's like
putting their mat and their gloves and they're like getting PP'd up, like getting their PPE all on.
That would suck because that's like an extra minute or two. And in terms of like someone trying to attack you, a minute is a very long time.
When there's an actual emergency, it feels like they're crawling to you. Like it does not feel like they're running. I know they're getting to us quick, but like it feels like they're going. So it feels like an eternity when someone's throwing haymakers. Like
absolutely,
yeah.
No, thank you. And I know you started it, and you're like, I don't want anyone to think psych is bad. Don't be turned away. But I mean, this stuff. Yeah, it's important to know what you're walking into. And
it's the reality of it. Yeah. But now I worked on a specifically unit for autism and intellectual disability. So most of these patients didn't even know what they were doing. Mm-hmm. They were separated from their norm. They were stressed out. They didn't know what they were doing. I have lots of great stories with like great turnarounds and like my coworkers were amazing. Like the only reason I lasted there for almost 3 years is because of my coworkers, truly. Because I had some really great friends that I worked with. Yeah.
Was this in Tampa or was this out of town?
This was back in Pennsylvania.
Oh,
yeah.
Because I was like, I don't know of a mental health facility for autism in this area.
It was just in this specifically. This facility was a hospital, it was a massive hospital. Each floor was dedicated to like a specialty. So,
oh wow,
yeah, the floor I was on was dedicated to autism and intellectual disabilities. Yeah,
awesome.
Yeah. So I love that population. Yeah, they're so fun.
They are. I used to work with autistic children. Yeah, and they can be very aggressive.
Yeah,
and they just don't know. And they don't know.
No, they're trying to communicate. Yeah, they're trying to tell you something, especially to a stranger. Like they're like the parents. They're like, oh, they want X, and you're like, I was never going to get there. Like, no, I was never going to figure that out.
Please tell me all the little intricacies. Of, like what he likes.
And often parents would like send you with a paper or like their favorite snacks because like we had some snacks, but like they like their specific things.
They are very particular about what they like and do not like.
Yes.
Yeah. So
and trying to get a kid like that to eat hospital food. Yeah.
He's like, "Where's the chicken fingers?"
Correct. I'm like
all kids.
Here's like the hospital mac and cheese. Like I hope you like it.
Oh yeah.
Yeah. I don't think I have any other true stories about patients. But my coworkers they truly made that experience what it was. We were in that together. Now, overall, I'm glad I left, but I do remember my coworkers and we would, after work, we'd go get dinner together just it was so nice to have someone like that to just, people that you could just trauma bond with and decompress. And they made that experience so much better for me. Yeah.
If you could change one thing about psych nursing, what would it be?
Definitely the support. I mean, psych in general is a massively underfunded project. Like it's just like the hospital itself, like the renovations that needed to happen that just like they weren't funded. The amount of staff on the unit, we were short staffed for 3 years. Literally every day there was extra shifts. No one ever was sent home early. and if you happen to have one extra person, they were floated somewhere. Like that entire hospital was short staffed.
Do you think that when it comes to psych in general, especially in a hospital, that they are like bottom of the barrel?
For sure.
Yeah.
For sure. Because when you can't see something and you can't have a lab test that tells you have a problem, those issues suddenly don't exist to some people. And so, and that population is a massive population that people just take their hands away and say, I'm not going to do that. And it's kind of what the hospital does with it too, at least in my experience. Yeah, we were just massively undersupported. Yeah.
I had a psych rotation.
Yeah.
But it was during COVID, so I only got to go twice.
Yeah.
And I could just see how run down the facility was.
Yeah.
And it wasn't a huge hospital.
Yeah.
It wasn't like the one that we work at.
Yeah.
The psych unit was run down.
Yeah.
Looked crappy, looked dirty.
Yeah. Right. That's how it felt too. Like everything felt like it just smelled like urine all the time.
It looked kind of like a prison.
Yeah. No, that's totally. Everything on the walls is bare. There's nothing on the walls. There's not even like oxygen on the walls for you. Like it's just bare walls. It looks like a prison.
I spent majority of the time sitting with patients and talking to patients, and that was, of course, very interesting. But I didn't really see much nursing tasks besides, taking a few meds out of a little thing and passing a few
It's just
meds.
medications.
Otherwise, it's like I really didn't see any other type of nursing.
No.
Do you feel like you almost, right out of nursing school, do you think that skills-wise there was like a kind of, like you forgot a lot because you didn't really do much?
But I did take, because of the population I was in, there were some kids with Mickey buttons that needed that kind of stuff. The majority of their tasks were related to their med pass, and they might only get meds once a day, and then they would go to bed. And then if they needed PRNs, as far as like everything else that they needed, we tried to do a lot of group therapy with them, keep them organized to what day it was, what time it was. We would always do a morning group therapy about who the staff was for the day, that kind of stuff. But as far as like nursing tasks, you weren't bringing your stethoscope out and listening to their chest. Like not that. So that is very different. And I think whenever I was in nursing school, that I was almost like excited to see something else, right? Okay, yeah. Like I was excited to see something else. Yeah.
I think I would enjoy taking a step back from the task part of nursing, like very bedside inpatient tasks.
Yeah.
And more of like getting to know the patient, talking to them.
Oh, yeah.
Like,
I would sit on the unit. We would just chat.
Mm-hmm.
Like, color.
Do a puzzle.
You know how many Uno games I played while I was in the NICU?
Some of that wouldn't feel like work.
No, yeah. But at the same time, it's like you almost have a little bit of like, why is it so chill? Something's going to happen. Like it's never, or if it's not on my side, it's going to be on someone else's side. And so there was always a little bit in like that noise, that button of that alarm, it's still like burned in my brain because it was so traumatizing. And if it happened early in the morning, it wakes all the patients up. Like it was.
Yeah, that sounds horrible.
Yeah.
I still hear alarms right now.
Right now, yeah.
Let alone like a shit button, essentially.
And it was so loud. Like it was ear piercing,
kind of like a fire alarm.
Yeah, it was like a fire alarm.
You're literally
repetitive. It was a repetitive.
I can feel it like vibrating sometimes. It's so loud. Like it's painful.
Yes, and so that like you'd hear it go off, and you literally would jump in your chair and be like oh my god, and then then you were running wherever.
When the alarm went off, would it say okay in this room?
No,
like how you just have to look for the crowd.
You had to find it. Yeah,
oh no,
and so sometimes you couldn't find it. Right. And so you knew somebody hit
for the person that hit
correct,
the button.
Correct. That happened to one of my friends where she hit her button and she was around like a corner because our nurses stations were behind bulletproof glass. And so she was around the corner. She hit her button and everyone checked like the main hallways and no one went around to that corner. And she was literally getting punched in the face by a patient. Yeah.
I would quit.
She was out of work. She was out of work for a long time.
Oh, poor thing.
It was really bad for her. Yeah.
Yeah. Can you imagine you hit it and no one
Oh my gosh. And like
I would be traumatized.
Yeah. And you know what's really fun too is sometimes the patients would be like, "It's over here."
Get them.
They'd be like, "Ah."
Yeah. I mean, they don't want
No.
To deal with him either. Or
no, and they don't
whoever.
and especially the patients that, were a little bit more aware, they knew no one should be hitting this person. So like, yeah.
Wow.
Be like, ah.
Okay, so looking back and especially comparing it to where you work now.
Yeah.
Could you ever see yourself returning to psych?
No.
No. What ultimately was like your definitive, like, I'm leaving moment?
Yeah. So there was a couple things that happened.
Yeah.
So it was COVID and I was working on the COVID unit and there you didn't take your PPE off. Like once it was on, you didn't take it off and that burned me out so bad. Like it was exhausting.
Yeah.
And you would sit there in your like trash bag in your N95 and like you would sit there for your entire shift.
I've been there. It's horrible.
Right. So COVID was really bad for the psych hospital. Now, do I blame that hospital? No, because no one knew what they were doing. Right.
Yeah.
So I was kind of like, I have to get out of here. But at the same time, I was like, I don't know where, this is all I've ever done. And I don't know where I would go. So then that's why I kind of started thinking, where could I see myself? And where would I be happy? Most importantly, where would I be happy? Yeah.
So psych and NICU are very, very different.
180, yeah.
How did you come to the conclusion that like NICU is what you want to do?
Yeah, so I was a NICU baby myself. Me and my siblings are triplets, so we were in the NICU for me and my sister for 5 weeks, and my brother for 8 weeks. Yeah.
How many weeks gestation were you?
31.
Oh,
yeah. So we actually in the NICU world, that's pretty good.
Yeah,
right?
you guys were out of there.
Yeah.
Pretty quick.
And my dad is a pediatrician. So I bounced a lot of things off of him because I knew I kind of knew I liked working with the kids at the psych hospital. I kind of had that direction I wanted to go. In the glory of leaving that hospital in the middle of COVID is I could go anywhere. I applied to Mother, Baby, L&D, NICU, everywhere, and got a job offer anywhere I wanted. Like I just had to pick.
Yeah.
But it was COVID, so you couldn't go see the unit. So I literally didn't see what I was walking into until my first day on the job. I just went for it. My parents told me so many great stories about the NICU nurses that took care of us. I was like, you know what? Let's see how it goes. If I don't like it, I will go do something else. And that's the beauty of nursing.
Yeah. Really, you can do anything.
Yeah.
What surprised you most when you first started in the NICU?
Yeah.
Because of course, now knowing that you didn't even get to walk it or anything.
I think the thing that shocked me the most when I walked in the NICU is how many of ICU things that you see. You know, in nursing school, we see all the ICU stuff. But when you go into the NICU, we have all of that, but smaller. And you do all of that stuff. Like it's all the critical care things. It's not just holding and cuddling babies all day like some people think.
Yeah.
Like it is small kids fighting for their life. And that was seeing like my first 350 grammer. That was shocking.
Oh, it is. Yeah. I would be so amazed because they look so different.
Yeah. You can't even like
just
try to look.
Hairs
Yeah.
Unless you show a picture of it.
But even then, a picture doesn't do it justice of seeing it in real life and seeing the Christmas tree of drips keeping that baby alive. And like, it
is absolutely
that
insane.
was really shocking.
I remember walking in and being like, uh-oh. What do I do? It is scary. It's terrifying.
Yeah, it is terrifying. And I think if you're not scared, then you should be.
Oh, yeah.
Like, yeah.
You walk in and it's just like lights galore, machines galore.
Yeah.
There's a thing, a blanket over the isolette.
Yeah.
So you can't even see what's in
can't
there.
even see the person.
Oh my God. Or there's sometimes plastic over the baby. So and the baby's like, do like that. And you're like, I'm in charge of this.
It's like a chicken tender in there.
This is horrible. It's so scary. It is.
Yeah. That was definitely like, okay, I got a lot to learn. Like,
this is a lot different.
But I was also ready. Like, I was so ready to jump all in. Like, I was so ready.
I think from the beginning you've been like a star on the unit.
Oh, thank you.
Yeah. I mean that.
I appreciate that.
Yeah. What milestone, it can even be small, do you think is like the most exciting or rewarding for you?
Yeah. Baby milestones?
Yeah, for the babies.
I love when you get to dress and swaddle them for the first time. the little tiny booty in there, and just seeing them all done up for the first time is so special, especially if you saw that baby when they were really, really small and you watched them get big. Watching them, dressing and swaddling them for the first time and matching their outfit to their linens and their hat, and like, it's the best.
If NICU nurses came with a warning label, what would it be?
I think it'd be like, don't touch my baby without talking to me first.
Don't walk in the room, actually.
Just talk to me first.
Anything.
Don't look at anything. Don't blink at them. If they're sleeping, talk to me, especially the big kids. If they're sleeping, you better speak to me first. I always say, if you wake them, you take them.
Oh, yeah. Like, don't go in there unless you're ready to hold a baby.
And yeah. Or even the really littles that don't tolerate touch outside. I'm like, no, we're going to coordinate together.
I don't feel like saving a life right this very second. Yeah. So, like, you need to wait.
And I'm like, you're going to go in there and mess this baby up, and then I'm going to have to deal with the consequences. So we're going to actually talk about this as a team, and we're going to work something out. How about you come assess them whenever I'm in there?
Yeah. Like, it's especially totally fair. The NPO ones that are like super... They got so many things. Yeah. No.
Super touchy. Don't touch my baby without talking to me.
Yeah, because it's always like surgery, and then the resident, and then the attending wants to take a look, and then the family wants to leave the door open for 5 minutes, and you're like, guys.
We're like, we need to leave this kid alone, please.
Yeah, he's literally telling you, leave me alone, and no one listens.
Yeah, ever. Yeah, most of the time people are very like cognizant of that.
Yeah, for sure.
And they're like, oh yeah, totally. Yeah. Especially the residents are usually scared anyway. So.
Oh yeah, for sure. I actually had someone come and ask me the other day. It was for, I'll bleep it, but.
Oh yeah.
And they were like, can I go in there? I'm like, no.
Yeah. I'll call you. Absolutely not.
I will call you when I go in there.
Yeah.
How about that? Because no way.
And all it takes is like a secure chat. When you going in there, I'm going to come meet you, or call me when you're in there. And chances are, like, on rounds, just say, hey, what time you going in there? I'll meet you in there. Like, that's it.
Literally.
Yeah. I feel, and especially NICU nurses are so territorial over our stuff. Like, it's,
I'm also very particular about my room.
Me
Not only
too.
the baby, but like I walk in and get report. I'm immediately cleaning behind someone. I hate a room being messy. It has to be like completely spotless.
Yeah.
Nothing on the counter.
Yeah.
Like just.
Yeah.
So people walk in there, they'll like open up alcohol pads, throw them on the thing, do this, do that.
The bed, the like messy. One time I walked into a room and I was getting a report, and there was a random burp cloth just sitting in like in the bed on the linen. So I just picked it up, and it was a baby that was in an isolate. I picked it up and there was blood on the bed. I'm like, oh, so we just
she put that there so you wouldn't see
and that didn't exist. Like we're gonna cover that instead of changing the linens. Yeah,
I can't stand.
I know. I had a family tell me, they're like, we've seen you get report, and the second you get in report, you're fixing, adjusting, and and I'm like, yes, because I have to get my day started off on a good note. Or when the linen drawer is messy, or just things just taut. I'm like, yeah.
It's a pet peeve. Anyway, okay, so what unique skills do you think it takes to be a great NICU nurse?
I think number one is you have to ask questions.
Yeah.
You can't be afraid to ask questions and to learn from anyone. No one is trying to spite you if they're explaining something. Take everything in. Take everything for face value. If a doctor is teaching the residents, listen. Because that's how you're going to learn, because the family's going to ask you that question one day. And you are going to look silly if you're like, I have no idea. Yeah. But don't be afraid to ask questions. Don't be afraid to ask, hey, for my education, can you just explain this to me? Can you explain to me what a PDA is? Like, and so then everything starts clicking that way, and you start connecting all of these loops. And it's that I feel like if I can teach any orientee ever, I'm like, please ask me any questions. Stop, ask me a question, anything. They're usually terrified.
Oh, yeah. I don't get students often, and I don't necessarily orient, but I do have people shadow me quite frequently. Yeah. And I don't mind it.
Yeah.
But I'm always like, okay, what questions do you have? What questions do
you have?
And
they're like, none. I'm like, how?
Because they're like, I don't even know enough to ask them, but no. I mean, we've all been there, of course.
For real, yeah.
Yeah. I think it's just overwhelming because, again, you do walk in and depending on, even when the baby is actually a grower feeder, there is a lot in the room.
Yeah.
So even if the baby is like completely fine.
Yeah.
There's like.
It looks like a lot to someone, yeah.
Okay, so of course in the NICU, there's different acuity levels. So you have your grower feeder, and then you have like your little ones that are growing on CPAP, and then of course you have your babies on drips, intubated, the whole shebang. What would you say is your favorite level?
I love the little kids, those like high acuity 1-to-1, 2-to-1 type of patients where you are so mentally locked into them all day and you really learn them so well, and especially watching them get past those things. But I've always like that adrenaline of like the true ICU life. Now, don't get me wrong, I love taking care of the feeders. Sometimes you need that, but I really like whenever you get that small baby and they're intubated and you are that person. Everyone, like, you know, you're their voice.
I love that. We need nurses like you. I'm the opposite. I'm like, I like the middle ground. I like 1 and 2. I don't like 3, but I like the middle. I love the middle ground.
I've gotten more comfortable with 3 over the years.
How long have you been a NICU nurse?
Going on 4 years now.
Okay. How long would you say it took you to get comfortable and excited to take care of a very sick baby?
I think definitely I had to get through my first year.
Okay.
After my first year, I then transitioned to being on a part of the delivery room team in my first NICU. I was kind of thrown into that, and you had to get comfortable. And I learned a lot doing that. And I really loved doing that whenever I was there. So I think I got really comfortable then. And then since then, even transitioning to being in this hospital, I feel like, I mean, I had to prove myself a little bit. No one knew where I came from or what I did. But then as you build their trust, they give you these assignments. And then, I mean, you're learning something constantly. And even if I'm like, why are we, I have no problem being like, why are we doing this? Could someone just explain that to me? So I know, and that's how you learn. That's how you grow. Yeah. But I would say probably a solid 2 years.
Okay.
Until I was like, I'm not like going to throw up.
That's the feeling I get. As you know, we had to change assignments because I am just so nervous.
Yeah.
So I actually start some more orientation shifts, just 1 or 2, just to like dive in a little bit.
Yeah.
For those really sick babies.
And it is intimidating, right?
For some reason, the intubation, all that stuff doesn't necessarily bother me, but
once
all
you
the
get
drips,
the
and then all
added.
the things add on, and then of course they're 400 grams and the whole thing, it just immediately anxiety.
No, it's hard
because it's so important. And
I mean, I even feel like if you say you're comfortable taking care of those small kids, you still, there's a little piece of you where you're like, but I know if I need help, I know when to get help. Like, and that's, I mean, because even NICU nurses that have been there for 10, 15, 20 years, you're still going to have questions.
Oh, yeah.
Yeah, you know, there's still going to be something that you haven't seen ever.
Yeah, at first I was like very embarrassed because I was like, oh, like everyone's just going to think I'm a wimp or I'm a scaredy cat. And I am. I'll just say it. I'm a wimp. But, you know, I don't care. I'd rather be straightforward and open and just say I'm scared, because when you really start talking to people, a lot of people feel that way. Yeah. So if I have to like take the face of it, I'll take it. Yeah. I'm fine with it.
And I think people do appreciate that then too. Yeah. Like they just let me know where you're at. So then this is where we're going to start. Like, and that's, I think even when I have an orientee and they're like, I'm petrified to move this person, I'm like, well, that's what I'm here for. We're going to do this together. Like that's, and I think if someone doesn't tell me that, and someone that acts overly confident, that's scary.
It is scary. Yeah. That's when you do see them make very dumb decisions. And then I see that and I'm like, okay, I'm definitely scared now, because I don't want to be that person either, you know?
And that's why even sometimes if you have a question, you know the answer, you just need someone else to say that you're right. And that's totally fine. Like I do that all the time. I'm like, I know this med is compatible, but can pharmacy just tell me it is? Like,
that make me feel better. Yes. Close this tiny gap of anxiety for me.
Yeah, because I worked with a person in my first NICU that was overconfident about everything. And she made a lot of mistakes, like really like scary mistakes. And was overconfident about everything. And just like, I could take care of anyone in this NICU. And she was like a year in, and I was like, whoa, whoa, whoa.
That's asking for a bad outcome.
Yeah, and it's just, I mean, if you think you are that ready at like a year, even 2 years in, you just got another thing coming. You should be scared.
A patient's life.
Yeah, you should be scared.
Yeah.
Yeah.
Okay, so would you like to share any memorable stories from your NICU experience?
I had a lot of families that treated me so good in my time. Yeah. Especially that was a massive difference going from psych into NICU. People
were very even saw the family
and they didn't care about you. And then you go into NICU and so many families care so deeply. I took care of this baby that was put up for adoption. And the family, when they came in, I met them their first day that they had signed the papers. Aww. And the adoptive parents became her parents. And that was so special to me to see it. And then I took care of her the rest of her time in the NICU. Watched her grow, watched her get big, and then ultimately watched them go home as a family, watch people not only become parents, but really like take this baby and love her so much. It was so special. And I've taken care of a couple patients like that too. I just took care of another patient that he was also adopted to a gay couple, and I loved them so much. They were so, oh my gosh, watching them become parents was so I cried in that room with them. Aww. Like they were those and you truly become like, you feel like a part of their family. They treat you like that. Mm-hmm. And I love that about the NICU.
Absolutely. Mm-hmm. I think I met the baby that you're talking about and the dad.
Did. Yeah.
Did he discharge?
Yes. Oh, yes.
He was so cute. And the dad was so sweet. Yeah. And he was so smart. He knew exactly what was going on.
They were so on top of everything. And if they... It was kind of similar. I'm like, do you want to be a NICU nurse? I was like, aww. You ask such great questions. Yeah. You were on it. You like, because I remember teaching them like how to change the diaper. And then by the time they were going home, they were whipping through that. They had no problem. Like,
I remember I walked in and
they like have milk warms. They're sitting feet.
Oh, yeah. I know. Like he didn't finish his bottle, so I needed to tube the rest. And he's like, oh yeah, can you put that on the pump for like 15 minutes? He only took half. I'm like, okay, sir. Yes, I can. Thank you. Normally people aren't.
They don't know that much.
Yeah. Oh, they didn't finish, but he was.
They were so in tune with his care, and I loved that.
I love that too.
And I could nerd out about NICU stuff with them, and they truly like absorbed it, and everything made sense to them. Like it was so special to like really go through all of these little things, and they asked really great questions. They are the best. Like, and that's why I love watching these families become parents. Like, it's so special. One of the scarier days I had in the NICU was my first day by myself as a delivery room nurse. It was my first time by myself, going to deliveries by myself. There was a set of twins that popped up on the board. Twin-to-twin transfusion, and one was hydroptic. Thank God, though, I was with a transport nurse that she was a transport nurse for like 30 years.
She's like, I got this.
She could put an IV in an orange. Like, she was so good and cool as a cucumber. Like, she's like, we got it. We're going to be cool. They call the delivery.
I love nurses like that. Yeah. I'm like, I need your energy.
Yeah. They call the delivery, and our plan was I was going to take the stable of the two. I was like, great. I'll do it. Yeah. I will take that. I'm kind of scared. And she knew I was scared.
Oh, yeah. It's hard to hide it.
Yeah. And so, I mean, there's a whole team in there with you. The baby comes out, and they flop the hydroptic baby onto my radiant warmer. I was like, all right, we're doing this. We're going for it. And they cut the cord without clamping it. Yeah. So this baby comes out down, and I am looking over, and she has the baby that's just small but on bubble. They have her wrapped up. They're like, we're gonna go to the NICU, and I was like, we're coding. Like, yeah, I was so unbelievably scared that day. I never wanted anyone to feel my scaredness, but I mean, if I said I didn't, if I said I didn't know what I was doing, I don't know what that is, or what do you mean? Like, that was my first hydroptic delivery. And I then ended up taking the baby back to the NICU, getting her stabilized, and kind of becoming her nurse then, because she needed one nurse. But that was one of those days where, as a NICU nurse, it is okay being like, I am petrified. And someone else probably is too.
Oh, yeah.
And there's going to be someone else that's like, I've been doing this for 30 years. We'll get through this. Mm-hmm. And there's that. I love that about the NICU. But yeah, that was one of the scarier stories I have of being in the NICU.
I love the NICU in terms of like how long people stay. The turnover rate. I mean, of course, there's going to be turnover anywhere you go. That's just how life is.
Right.
But the NICU has such a good turnover rate. People love what they do.
Oh, yeah. If you're a NICU nurse, you're a NICU nurse for life. Like, it's like everyone says I could never go do anything else.
Like, can you imagine going to med surge?
No.
You could be there for one day and be like, why on earth did I come here?
Why are they talking to me?
Why are they yelling at me?
Yeah.
Okay, so what advice would you give a new nurse?
Yeah.
Or even just new to NICU, what advice would you give them?
Go in ready to learn.
Yeah.
Forget everything you just learned in nursing school at another unit. Forget it all. Everything's gone. Everything's different here. And you need to be ready to learn and accept the new norm for what your patients look like, and to be ready to adjust your assessment skills to these babies, because they're going to look at you funny and you're going to have to figure it out. Like, and so I think that is one thing as a NICU nurse. You have to be ready to adjust to and forget everything you once learned. Yeah.
Mm-hmm, absolutely. Your assessment skills get a lot better.
Yeah. Oh,
because it is those little...
Your eyes have to tell you everything.
Literally. It could be like, oh, well, the baby's oxygen is normally here, or respiratory rate is normally here, but today he's acting... It could just be his respiratory rate's off.
Yeah.
Or he's a little agitated, and you're like,
he wasn't like that yesterday.
12 hours later, he's getting a workup, and he's, you know...
Or even things. Just like little things, you notice his heart rate is sitting 15 points higher. Why? What's going on? And then you go through the list. Is he hot? Is he uncomfortable? Is he like, and you run through all of these things. But as a new nurse, you don't know that. Like, you have to like really think about that stuff, because in nursing school, well, someone's hot, they're sick. Not necessarily in the NICU,
It could be your probe is in the wrong place, or the bed is malfunctioning.
Yeah, you're tachycardic, and we got to figure out what's going on.
Yeah. And it's a lot different, because adults can tell you, oh, I'm nauseous, or oh, my stomach hurts, or it's a lot more straightforward. Yeah,
for sure.
Looking ahead, what kind of nursing do you plan to focus on?
Yeah, so I'm staying in pediatrics. I just know that's my home. I'm moving forward with my nurse practitioner degree, so that's stressful and exciting at the same time. I want to transition into more of a primary care type role, just for my future, knowing, like, do I want to be in an ICU forever? Probably not. Mm-hmm. So I love the NICU. The NICU will always have a special place in my heart. I always wonder, I'm like, I'll probably even like come pick up shifts as a bedside nurse, but transitioning into a role of a practitioner role more is what I'm looking forward to in my future.
Yeah. Mm-hmm. How long have you been in the program?
Going on a year now. So I have a year and a couple months left. Yeah.
Do you feel pressure or excitement? How do you feel towards being a provider, making incredibly important decisions?
Yeah. Like, cautious anxiety. Like, I think because my dad is a pediatrician, so I think it's nice I talked to him a lot when I was making the decision to go back. And so, I know the weight that carries. And when I was making the decision what field I wanted to go into, why I made that decision, that played a factor. But definitely, like, nervous, but also, like, I was nervous to become a nurse. Yeah. You just learn. And so, cautious anxiety.
Yeah. When you first became a nurse, did you always have this, like, idea that you wanted to do in P, or was this kind of like just...
I mean, a part of me yes and a part of me no. Like, when I first got out of school, I was like, I'm never going back. Yeah. Like, I'm so done with school. I'm done with tests. I'm done with studying. And then as I started learning and developing in my nursing career, I just found a passion. I love learning, and I love, like, constantly turning over a new leaf and developing in my career. So it was kind of a natural progression of where I knew I wanted to go.
What classes are you in right now?
Pharmacology and health assessment.
Ooh, those are the pharmacology is so hard.
I know. That's why I was like, going back, I was like, I'm not looking forward to pharmacology and the 3 Ps exam. But everyone, you know what? If it was easy, everyone would do it. So I'll get through it.
And you're working full time still, right?
Yeah. School full time and working full time.
Well, thank you for being here again, because wow.
Like, time management is...
Oh, yeah.
Yeah, you can do anything.
Did school start now, or did it this week?
Yeah, this week.
Girl, you're a busy bee.
Yeah, but I mean, and I'm such a dork that my planner that's in my purse is my life. Oh, absolutely. I have a paper planner with how I organize everything, and if I could give advice to an NP student or students, get a paper planner. None of this iPhone stuff. Paper planner. It is so nice to see everything written out. And I plan out my entire semester. All my stuff is due and like that. Yeah.
Yeah, I'm the exact same way. I have to have it on paper. Even textbooks.
Yeah.
Paper.
Paper's so much better.
In front of me instead of like this online crap.
Yeah.
And I would even do silly things as like if I needed to read, I'm a to-do list girl. And I love to like that satisfaction of like highlighting it out.
Yes.
And I would say, read chapter 5.
Yeah.
Answer all questions for chapter 5.
Yeah.
And I would write every single minuscule thing down that I had to do.
It's so nice to check things off. Like
satisfaction.
Yeah. And you look back, and what I love at the end of my semester, I always look back, I'm like, wow, I did so much. Like I really did that. Like it's so nice to look back and just like see everything. Like, but yeah, my paper planner is my life. That's the only way I could do this.
When do you graduate?
May of 27.
That's not that far. It'll fly by.
I know. The first year went so fast.
Do you do summer classes?
Yeah.
Girl. So
yeah,
how do you
straight through?
So I know you're a traveler. Mm-hmm. How do you tie all of this in?
Planning. Yeah, like because I'm going to Greece in July and I'm going to be in clinical rotations, but you have to just get so many hours. I'm like, okay, I'm going to grind my hours because I have to do 135 hours between May and August. And I'm like, well, I'm just going to grind out my hours to make sure that I can go on my trips. Thank God all of my assignments are submitted online, so I can submit them from anywhere.
That is true, yeah.
I planned a wedding while in school. I went on my honeymoon while in school. I went on my bachelorette trip while in school. Like, you make it work.
Oh, absolutely.
Yeah. And worked full time.
That is crazy.
Yeah.
So I feel like a lot of nurses kind of have that idea, like, oh, I want to go to NP school. I want to go to NP school. And I think it's such a life-changing decision. How did you come to the decision for yourself? Like, okay, I'm going to start now.
Yeah, I thought about it for like a whole year.
Yeah, that sounds about right.
Also, I was worried, how am I going to pay for this? Am I going to be able to work? What direction do I want to go? You have to pick a program. And so FNP is the dominator in the nurse practitioning field. And so everyone says to go for your FNP and then you can go anywhere. I'm like, deep down in my bones, I know I don't want to work with adults. Yeah. So, and my dad helped me with this so much. I was like, do I go FNP or PNP? I toyed with it so much. And I was like delaying school because I didn't know. Yeah. Like I knew I wanted to go back, but I didn't know what program.
And don't you have to like kind of know exactly which
you
one
have
before
to apply
you start?
To the program that you want to go to. And so my dad said to me, he's like, as a provider, you need to be confident that you are a master in that field. So if you know you want to go into pediatrics and you spent 20%, you spent 20% of your school talking about pediatrics, are you going to be confident then any patient walks into there and you see that you are going to know what's going on with them? Like, and I'm like, and that's what led me down the pediatric path.
I love that.
Yeah. The wisdom, right?
Yeah, of course. Yeah. Does your dad live in the area?
No, he lives in New York.
Because I was going to say, can you shadow him?
I wish I could.
Because do you have to find your own?
Yeah.
Have you found any so far?
I have my first one.
Okay, good.
But it's a struggle, every single one, because especially being in a large college area, you're fighting all of these nurse practitioner students for this limit, especially because I have to do all of mine in pediatrics. And so the family people also need to do pediatrics, and like that, your specialties, you have to do your clinicals and your specialties. And so you're fighting all of these people for these limited spots. That's why they book out 6 months in advance.
Oh, yeah. Absolutely. Yeah. It's like a whole thing.
Yeah. Oh my gosh.
I feel like that's crazy. One of the hardest parts of NP school is finding your preceptors.
1,000%.
You think that the schools would guide you?
Yeah.
I mean, how much are you paying?
Literally.
The least you can do is...
Yeah. Some schools find your preceptors for you, but then you're paying for it. That going into nurse practitioner school, I wasn't totally... people warn you of that, and I wasn't totally aware. I'm glad I took that year off because I also moved to Florida in that year. If I would have been in Florida trying to find preceptors as a new resident, I would have had no idea.
Oh, yeah.
Yeah, because you just meet people along the way, and like, yeah.
So... going back a little bit, you mentioned paying for school.
Yeah.
So, the new...
Yeah.
We're not professional.
Yes.
Has that affected anything yet with your NP program? And
so
financing?
it's going to. So in July is when the federal fund, because I pay for school with federal loans. Now I cap at $20,000 a year. My school is $30,000 a year. So they're kind of just like, you got to figure it out from there. No one's lowering their tuition. Nobody.
If anything, they'll raise them.
They don't care about how you pay your tuition. They just care that it's paid.
Yeah.
And so it's going to affect me in July when my federal funding, especially my fall semester, my federal funding caps out. So I'm kind of at a point where I know I want this. I know I want this so bad. So I'm not stressing about it because it's out of my control. When the bill does come, I will figure it out. If I have to take private loans, I don't want to. If I have to take private loans, I have to take private loans. I've made it this far. This dumb decision is not going to stop me.
Oh, yeah, of course.
Yeah, and I don't want anyone in nurse practitioner school to think, oh, well, I'm not going to get federal aid, so I guess I'm just going to have to be a bedside nurse forever. No.
Yeah, no.
But I'll figure it out. And
it's worth it. And you know what? It'll be over.
And that's what I'm like, I'm going to have essentially like only under a year with that. So I'm like, I will figure it out.
If anything, thank God you got in sooner and you started when you did so that you didn't have to do the entirety of NP school without federal loans. So.
And it's just, it really truly sucks for people going into the career because that was a driver for me I was hesitant because I was like, how am I going to pay for this? I had no idea until I talked to people in financial aid and they're like, no, you've qualified for federal aid and they qualified for, for everything. But people that are in like the nurse anesthetist programs, that $200,000 programs, like I don't know what anyone's going to do. Nursing is going to be in trouble.
Oh, absolutely. And I know that there's an oversaturation of NPs at the moment, but you let it go on for how long? When are you going to have a shortage?
But even then, actually one of my classes, we had to do research. The nurse practitioner field is expected to grow by 30%. Because by 2030. So we need NPs.
Oh, yeah,
I mean, just see in the hospital, we need NPs. Like, and I also think the nursing shortage thing is kind of like, I wonder if it's like a little bit of a hoax because how many people are nurses ready to work and they can't get a job? Whenever I moved to Florida, I applied to 45 positions all over the place. I heard back from 3.
Oh my God.
Yeah, 45 positions. So I'm like, this nursing shortage thing, is it a true nursing shortage or are these facilities not turning people over, like to getting people through the process? And people, or not to mention people going part-time because the job is rough.
Oh, absolutely.
Like,
I don't think there's a nursing shortage at all. I think there's a shortage of nurses who want to put up with bedside.
Yes. Or how many licensed nurses are there versus how many nurses are in the field. Oh, like that number, people should be like, what is going on?
100%.
Like
something's wrong.
Yeah.
And it's always been wrong.
And it's not people retiring.
No.
It's people going and doing anything else because they make more money.
I have literally met like at least, I'm going to guess maybe 2 or 3. It might be more. People who are like, oh, yeah, I used to do nursing, but I left.
Yeah.
And I did marketing.
Yeah.
Or I did something random.
Yeah.
And it's like, I don't have to deal with any of that stuff.
Yeah.
I just do my job. I go home.
And making more money.
And making probably double.
Yeah.
It's crazy. When do you think it'll ever change? Ever?
I don't know if it will ever change. So in COVID, when we saw this nursing or hero type, stance, that was really cool to see that everyone. Was nice. That was really nice. And you feel it trickling down, right? Yeah, nurses are now, you feel it now. Like nurses are greedy because they want money. Nurses are asking for too much. Oh, they want a 30-minute break and a 15. Why'd they want that? You know what I mean? So you feel that transition from nursing being the number one trusted profession in the country to being like, why is everyone turning on us? We're just doing our jobs.
Weren't we just in a pandemic where you...
Yeah, where were your heroes? Like, you feel that. And so that, to me, I'm like, I think the people going back to nursing school is going to trickle down because they see that, Yeah,
Absolutely.
they see how people are treated. Social media has changed a lot with how realistic we are with our nurses.
Oh,
and even
100%.
just like how many times on TikTok do you scroll and you see a video of someone, I'm going into the hospital because the nurse is X, Y, and Z, blah, blah, and they're coming in hot at the nurse. 9 times out of 10, it's a decision made by the doctor. The nurse is just catching the heat for. And I'm like,
100%.
that's why people are leaving. That stuff.
Yeah,
you know?
of course. So how does NP school feel in comparison to getting your bachelor's degree? Harder, easier?
Yeah. So the bachelor's degree was harder in the aspect there was a lot of BS classes.
Oh, yeah.
The master's degree is hyper focused. Like, so you were just honed in. Now, I think the classes are harder. Like they, you know, they take pharm, they take patho, and they amplify that. So it naturally is going to be harder. I also feel like at this point in my life, I am not naive to what college is, to what a degree is. So I feel like I was well where I know how to study. I know what it takes for me to get a good grade. So that aspect has made the transition a lot easier, but the classes I would say are more difficult to be expected.
Yeah, of course. Yeah. I've gotten many times that NP school is easier than a bachelor's.
Honestly, yes. In the aspect of your preparedness, you know what you're signing up for. Like,
and you also have a very big base of knowledge.
Yes.
Before, of course, you're learning all of that for the first time.
Yeah.
So I think that could probably be a big difference as well.
But I would say for the most part, nurse practitioner school is a little bit easier than a bachelor's degree.
Yeah,
like
I've heard that a lot. That's why I think also that like people should not be able to go straight from nursing school to like NP school.
1000%. I agree.
You should have to work. Like, be in the field.
Yes. I feel like, yes, because that helps in nurse practice. I can't imagine trying to make the decision of how I want to be a nurse practitioner if I don't even know how I want to be as a nurse. You know?
I know. Because you're hands-on sometimes, especially like during a code and all those things.
Yeah.
Where like you are expected to be at bedside and making decisions. Don't you want to watch someone else do that first?
Yeah. No, I would highly advise new nurses to do 2 years of anything, even a year of anything before going back for their nurse practitioner. Not only the honing in on what you want to do, don't waste your time, but also that base experience.
And then also knowing what nurses are going through or what their job entails.
Yes.
So that when you're addressing them and asking them for specific things, you don't sound like an idiot.
Yeah. But even then too, you know you know what they've been through. You've been there. So like addressing them as such.
Yeah. Like okay, I understand what it's like to be a bedside nurse. I know that just because I put the order in 5 minutes ago that it might not be done right this very second.
Yes.
Because she's probably in a room doing X, Y, and Z.
Yes.
That's not even part of her job. Literally.
Right.
So I think that's very important.
1000%. Yeah.
Yeah.
I agree.
Okay. So if you could go back in time and and give your baby nurse self one piece of advice, what would it be?
Stand up for yourself, for sure. I let a lot, especially my first nurse manager, I let her walk all over me. I put up with things that were unacceptable. I would definitely tell myself to have more of a backbone. And I was just petrified to talk to doctors, to talk to my manager. I was terrified to talk to her. Like, I would definitely tell myself to have more of a backbone. And it's okay to, in a professional way, say, I just don't understand why this happened. Or I don't understand X. Or why, you know what I mean? That stuff for sure. But always in a professional manner, never confrontational, because no one likes that person at the job either. Yeah. But it's also like, and you want to be that person. You know how many new nurses, they're like, come to me with a problem, like then you go to them and you say to them, hey, I know you probably didn't mean it this way, but I didn't like how it came off. And then you develop this professional relationship and they respect you.
Oh, absolutely. Yeah. Definitely stick up for yourself.
Yes.
Because people will...
Families too will walk all over you.
And they will stomp all over it.
Yeah. Yeah.
Definitely.
And you become a better nurse.
Okay, so if someone were to come to you and say, I'm really thinking about becoming a nurse, what would you say?
I would say I would recommend the field, but you have to know what you're signing up for. This is not for the weak. It's not easy. If you think, oh, I'm going to be a nurse. I'm going to wear my cute scrubs and I'm going to You have to know what you're signing up for. And do I recommend nursing as a career? Absolutely. It's so rewarding, but you also have to know how hard the days can be. There's going to be days where you leave work and you cry yourself home. Then you got to go to bed and turn around and go back.
Yeah.
But it is very rewarding, and you have to find something that you enjoy doing. So I would say anyone that's thinking, shadow a nurse. See any field that you might think you're interested in, shadow a nurse in it. See what happens there. And you can get a realistic idea of what you think you might want to do. But yeah, I mean, overall, I love being a nurse. Yeah. I'm not one of those people that says I would never tell my kid to be a nurse. I don't think I would do that. I would tell them to be realistic with themselves and what they can handle.
I think social media pushes this. I mean, there's real sides to what nursing is like, but I think a lot of it is like,
but also La La
TikTok,
Land.
like, my hair's curled, my makeup's completely done, and I have my cute shoes on and my cute new scrubs, and come to work with me and my coffee.
Yes,
that's not it.
No,
it is.
It is to an extent.
For some people, that might be their reality, and that's 90% of it isn't that.
No, yeah, and I think that's fine. I mean, I do think being that light at work.
Oh, absolutely.
I love being that positive person because there's so many Debbie Downers in nursing. And if you don't like it, you just go do something else. That's my advice to everyone too. If you don't like what you're doing, go do something else. And so, yeah, I mean, even on the unit for me, I like being that person that's positive, that you can say hi to anyone. Nobody likes that person that will not even say hi to you in the hall.
I know.
Yeah. So go into nursing, know that there's going to be people like that, and that's not how you're going to be. Yeah.
There are a lot of jaded people.
And for what? We're all in this together.
I know.
Yeah.
I'm like, don't want to sit on the same row as you. And not everyone has to be like that.
Yeah.
And you can be the happy-go-lucky, bright, sunshine nurse.
Yeah.
And that doesn't make you a bad nurse or the dumb nurse. It makes you.
No. And I think people will respect you in the long run, too, because they can see how you can handle situations, but also still be positive. You don't have to be going in the break room and talking about the nurses on your row. Like,
it doesn't. And
sometimes you need to like get something out.
Yeah, but
yeah,
talking crap about other nurses doesn't make you a better nurse.
No.
I think people have that misconception.
Yes.
But if I talk crap about how everyone else does their job, maybe people think I do a better job.
Yeah.
It's not the truth.
And there's always people, I mean, don't get me wrong, I'm sure there's corporate jobs where you just hate that person in your cubicle next to you.
Oh, yeah.
I'm sure that exists.
It's everywhere.
But nursing is a different monster because of the things that you're doing together. You need your team. You don't need that person next to you to send that email. You need your team, and you need to be you need to be confident in them that they got your back. Yeah.
So just really know what you're getting into before you do it.
Know what you're getting yourself into and be ready for it.
I am so happy you came. Thank you for making time.
Absolutely.
On your busy schedule.
Anytime.
Right in the calendar. I need to check it off.
It's in my planner.
Yeah. Well, thank you so much for coming. I had a great time.
Thank you so much for having me. It was great.
All right, guys. Don't forget to like and subscribe. Bye, guys.